folks. Alex Tiersch here, founder and director of amspa, coming to you live from Chicago, Illinois. Happy Friday to all of our members. I've been getting a lot of questions about this, the statement from the Illinois Department of Financial and Professional Regulation regarding prohibited practices to be done by estheticians, specifically microneedling, dermaplaning, chemical peels. And I think it was appropriate for us to kind of chime in and give you our view, in my opinion, on what this means for the practice of aesthetics. So what this statement says, by the way, this statement has actually been out since earlier this year. Unfortunately, the department in Illinois, they are not an educational institution, so they have some difficulty getting the word out. So we are helping them to ensure that everyone knows what the rules are. One thing I want to say, I'm just the messenger. I'm not here to comment on the appropriateness of this rule. I don't have an opinion on it, really. All we do at the American Med Spa Association is make sure that you in the aesthetic industry are familiar with what the rules are so that you're compliant and you do not get in trouble. Bottom line is, estheticians, under their Practice Act in Illinois, as in California recently, are not allowed to perform microneedling or dermaplaning. The issue has nothing to do with the depth of the needles. It has nothing to do with the superficiality of the treatment. It has to do with the fact that it is microneedling and needles are involved, and therefore it is the practice of medicine. Now, what this means is that before microneedling, dermaplaning, any of the treatments listed in this statement, which includes chemical peels, before they are actually administered to a patient, that patient needs to see the doctor or a mid-level practitioner, either a nurse practitioner or a PA. I understand that's a little bit of a pain, but nevertheless, this is what the rule is. Now, what I also want my esthetician friends to know is that this does not mean that you cannot perform these treatments. It just means that there needs to be a face-to-face consultation with a doctor, a PA, or an NP before you do. And most importantly, the second part, which I really want the estheticians to look at, by the way, this is on our website, under the news sections, under state regulations, so you can take a look at this. You must not and cannot hold yourself out as an esthetician while you are performing these treatments. So the state differentiates between an esthetician and an individual who is performing medical procedures under the supervision and delegation of a physician. You have to make absolutely sure that it is clear you are not an esthetician while you are doing these procedures. Stay tuned to American Med Spa Association. Go to amspa and check out some of the new rules. We are going to have more information on this and some information on how to deal with these regulations as we move forward. And at all of our events that we're doing, we're going to be covering all of these new rules, which are coming out kind of fast and furious. One last thing, the trend here in all the other states is that this is how the aesthetic boards are going to handle this. So estheticians are not going to be allowed to do microneedling treatments or dermaplaning or dermablading or any of those things like that. So stay tuned, be careful, stay safe, stay compliant. Call us or visit our website if you have any other questions. Thanks so much.